Welcome back. AI is dominating the headlines, but what is it actually doing inside our clinics? Believe it or not, a massive new survey found that 67% of Ontario clinicians are already using AI tools, especially medical scribes. But with new tech comes massive questions. How do we protect patient privacy? What about legal liability? And how do you navigate adoption without going down the wrong avenue? Today, we're joined by Ontario MD's Chief Medical Officer, Dr. Chandi Chandrasena, and legal expert and Chief Privacy Officer, Ariane Siegel, to break down the results of Ontario MD's latest physician AI survey. We'll explore why scribes are the ultimate gateway tech, what's keeping the holdouts awake at night, and how to safely evaluate these tools for your practice. Plus, we're giving you an exclusive sneak peek into Ontario MD's Digital Health Conference 2026, happening October 1st and 2nd. Stick around to learn how you can use the event to speed date vendors, optimize your workflow, and future-proof your clinic. Let's dive in.
All right, so thanks for joining me this morning to chat a little bit more about AI. I understand you guys recently completed one of the largest AI surveys done so far in Ontario now. What were some of the most interesting, notable results there? How'd it go?
It went really great, actually, and thanks for having us on your podcast. So yes, we just completed an AI survey for Ontario. It was really about the use of AI in community clinics. We had about 1,650 clinicians and clinics answered, which doesn't sound like a lot, but it's actually a pretty decent response rate. And what we asked is, what are you using? What AI are you using? What have you tried? What are the problems? What are your challenges or barriers for adoption? What are your concerns about AI in general? Who would you trust? What is it that you need for AI to be onboarded in your clinic? And really what we're hoping, lots of data, and a lot of the data is really about how AI is situated in community clinics. It does provide a snapshot, though, of what's happening right now. So we're really excited to talk about that.
And then what was the intent going in? Was there something specific you guys were looking for? And I totally agree. And just the results of participation-wise, it's hard enough to get a single doctor to do anything, let alone that many. So congratulations on the success of it.
Yeah. So when we were initially, we were looking at is like, what's AI use out there, right? Everyone seemed to have a number. Everyone seemed to be guesstimating, but it was really hard to understand. And the purpose was, okay, let's just see how many are using it. How are they using it? And then how can we take that information and use that to inform our strategy here at OMD, how the OMA could be used, using that data, how Ontario Health could use that data. So it's really about information gathering and then a bit of a nudge as to where we should be taking healthcare in the future.
And then as far as adoption goes upstream, what were some of the results looking like?
I was actually really surprised when we asked about it. 67 of the respondents had used or were currently using an AI, which was a lot higher than I had expected. Of course, the most used was AI Scribe. About 58% had used or were using an AI Scribe currently. Then there was AI Clinical Decision Tools, and then AI Inbox, and then a variety of other AIs. And so what we found was that AI scribes obviously are leading the way. It's solving a documentation problem. And what we also found with adoption is that clinics wanted to adopt tools that actually help them with their workflow. So they weren't just adopting for the sake of adopting or jumping on that shiny tool bandwagon. They were looking for practical solutions that save time.
Very interesting. Why was I kind of know why. I've used a ton of the scribes. It seems like the obvious one, but why do you think that scribes was so popular by a mile?
Well, I think it's your gateway into AI is the way I look at it, right? It's low-hanging fruit. you're sitting in a conversation with a patient, there's a scribe, there's an AI output, and you can look at it and you can say, is that what happened? Right? So I think from a risk perspective within that environment, for me as a physician to say, can I verify this? It was it's a good gateway into AI, as I say, because you could validate it while you're sitting there. And I think also it really helps with the complexity of patients now. So you and I both know that patients that come in now have many, many issues. It's very complex. They can't get the care they want. So they're not quick visits. And so I think AI Scribe took off because all of a sudden there was a way to capture all of that in a meaningful way and save us time.
Very cool, very cool. And then when it comes to the clinical decision making, like I've used open evidence a little bit. Like if I've got a little curiosity, I'll type it in there. Like what are people using as far as clinical tools?
So I think for clinical decisions, it is the chat evidence type, the evidence chat type of AI that people are using the most. In fact, Ontario MD is doing a study right now with Ontario Health evaluating AI CDS tools. And the most common are tools like open evidence, just because, again, it tells you what the guidelines are. You can validate it. It's a question you're asking, you get a quick answer. But only, I'm just kind of going on memory here. In terms of CDS tools, only 18% were using it. So it wasn't that a large number were using them.
Gotcha. Okay. But catching up quickly, I imagine.
Correct.
Well, for all the clinicians, all the docs out there that aren't using AI, I don't suppose there was any insights as to what was holding them up.
There was a lot that was identified, but if we looked at the top 3 reasons for why they weren't using AI, it was really around the safety issue, the security, the privacy, the security, the liability, the regulation of using it. Those were always came as number 1. The contracts, the data governance, those were always kind of like, okay, I'm not really sure if this is safe. Second came time and cost. You're paying out of your pocket in the community a lot of time. So is it worth investing in this technology? But it's not just the resource in terms of finances, it's the cost of learning how to use it properly and integrating into your workflow. And then interestingly, the other bigger concerns that came out were about AI in general, over-reliance, de-skilling, misinformation. How do I know this is correct? That loss of human touch. It's changing a workflow that, I don't really want to change in that manner. So there was a lot that came out, but I would say the legal, regulatory, data privacy has always been number 1.
Interesting. And so these people, you think they're just purists? Like they've got their pen and their paper, their quill and their ink, no EMR, no nothing? Like what do you think it would take to get them on board?
Well, I do think it's going to take, it's taking it's confidence, right? That's what we found. Like if you're not confident in what you're using or you don't feel it's safe, you're more reluctant to use it. But I think the paradox here is 67% have used or are using it, but then they're saying, okay, we're not going to use it because of it. So I think people are using it even though they're worried. But that 1/3 is probably holding back, and because they're also later adopters of technology and they're waiting to see what happens is what I think is happening. And I know Ariane can speak so much about what needs to happen in terms of confidence for physicians and clinicians to use AI.
Yeah, this would definitely be your department as far as like the legalities and the privacy. Like, what did you take away from the survey results?
Well, number 1, it's really exciting to see how AI is being adopted and to the extent it's supporting physicians in their workflow, in supporting their patients. But the privacy, security, and legal considerations are important. And as Chandi said, they were the number 1 deal breaker. So let's talk about what makes AI tools special. So many AI tools, and you've described some of them, Jordan, are simple. Basic AI tools can act like a vast research center that you query with prompts. And assuming you're not putting your patient's health information in, the risk profile is not significant, but you still want the responses that you get to be correct, You want the AI to answer your questions, and you want the answers to be aligned to modern evidence-based medical practices in Ontario. And then you want to vet those recommendations using your own judgment. Decide, okay, do they apply in these circumstances? So in that situation, wow, what an amazing opportunity. Other AI applications are quite different, and consequently, the risk profile changes. So they provide the opportunity for AI systems to ingest and process vast amounts of patient data and physician data. And the data sets that the models actually train on need to be considered so that the recommendations that are outputted are relevant to local considerations. How the system works, the data sets, the models, the standards and guidelines they use need to put physicians in a position where they can make informed decisions. This is called human in the loop. And the more an AI response is embedded in a physician's workflow in their EMR, the less likely it may be for them to be in the loop and to actually be able to verify the output or the recommendations. So a physician's obligation is to vet the draft outputs of AI and apply their professional knowledge and act accordingly. Without the human in the loop, in this case the physician, the AI becomes a substitute, as Will Falk calls it. And that's why it's so important that we have some standards around AI in the province.
Attracting top healthcare talent is crucial for providing exceptional patient care, but connecting with the right professionals can be time-consuming and complex. Cherry Health bridges the gap. Our network allows you to showcase your organization, post jobs with precision and ease, and directly engage with healthcare providers actively searching for roles like yours. Whether you're an ambitious do-it-yourselfer or a seasoned recruiter, our intuitive web platform makes it easy to showcase your open roles and organize your applicants. Need a more personalized approach? Cherry Health Staffing Solutions offers dedicated recruiters to find and vet the perfect candidates for your specific needs. Build your dream team with Cherry Health. Visit www.cherry.health and start growing your team today.
And then, I don't know, like, is there a nationally emerging standard? Like, if I'm weighing out a scribe, like, what is the number of errors that's acceptable? Like, where does this start to become a problem? Like, how does a clinician actually kind of...
That's a great question, and that's part of the evaluation that we're doing. It's part of the work we did when we looked at AI Scribe. It's part of the work that we're doing with Ontario Health with respect to AI clinical decision support. Health Canada, of course, at the federal level, has a certain regulatory authority for devices. And the question is, well, where do these AI tools fit in? And looking at the issues and the risks and local needs, meaning province by province, we need to consider, well, what are the safeguards that need to be in place? Clinicians ultimately are responsible for protecting patient trust. They're licensed professionals that have a duty of care to their patients. And this obligation is a core component of their medical training, and that duty existed long before any legislation. With AI, we can't put all the burden on physicians' shoulders. We have to enable physicians to be able to do their jobs, to be supported by AI, and to help make these tools good for patients and good for the physicians.
It's a really interesting, just entire subject. Like, I saw one article and they were just talking about like the error rates in the latest medical specific AI tools being higher than just the general public now has access to the newest model of, you know, generic LLM that hadn't been used for the training for the medical layer. And I thought that was kind of interesting, just like how the error rates are just so rapidly evolving. And like then you've got the doctors kind of in the middle here as the self-governing profession. Like we got to make sure that, like, you know, managing trust, managing patient safety, privacy, all these things. But like at the same time, your patients, if you're using the tools that you should be using, you might potentially be having better, more accurate, less error prone AI medical access anyway, just from the latest Chat GPT or Gemini model. So it's really kind of an interesting space right now, how quickly things are moving.
And based on what you've said, you can see how important it is that we help develop a system that's going to work for patients and one that's going to work for physicians too. The starting point is really understanding how a tool benefits a patient and a physician. And if there's a benefit, fantastic. Then we got to figure out, okay, how do you best vet that tool to make sure bias and accuracy and privacy and security and legal liability are managed appropriately. So the starting point, and Chandi emphasized this at the beginning, is how good is that AI, and is it really helping a physician provide care to the patient? And if the answer is yes, well, we need to do whatever we can to get a great system up together to support adoption and to support.
Is there any evolving standard now, like as far as AI tools, whether it be like the clinical decision making, whether it be the scribes? Like, how does a prospective clinician just get started here without going down the wrong avenue?
The work that Ontario did with respect to AI Scribe and the Vendor of Record program was actually groundbreaking, because it actually set up a system guided by physician issues to procure AI scribes in such a way that physician obligations were maintained. And of course, as those standards emerge and change, as the tools change, so too do the vetting programs. But starting from a base of, let's look at these tools, let's understand the benefits, let's figure out the risks, and let's get them implemented in a way that's going to support physicians. That's the best place to start. We learned so much from the Vendor of Record program. It's up and running. It negotiated contracts that were physician-facing to help manage that shared liability component. And it's a really great place to start. I think we need to build on programs like that to help with the rollout and implementation of these tools.
How are we doing so far? I keep seeing news stories popping up where, some lawyer got in trouble because his AI was citing some nonsense that didn't exist in their big legal precedent.
And as a lawyer, I worry a lot.
Is this happening?
As a lawyer, I worry about that. And of course, physicians are going to worry about how AI is being implemented in practice. And we see lots of news stories focusing on the bad things that happen. There's also plenty of good. And we need to spend our time thinking about that, learning from the benefits analysis that are being conducted, getting physicians to lead these analyses to make sure the tools are actually providing them with a benefit, and also protecting patients and protecting physicians from risk.
Any other final thoughts as far as getting started with AI then, like for the prospective doc, the prospective NP, like what do you say to them?
Yeah, it's interesting, and I listen to Ariane quite a bit, and every time she speaks, I learn more and more and more, because I think as physicians, we're not trained to be looking at technology this way. But I can tell you, as physicians, we're trained to be critical. And that's something that is transferable to all technologies, but also AI. So when I'm kind of speaking with a lot of physicians, I kind of talk to them about, okay, well, how do you decide if you're going to use a new drug? How do you decide if you're going to do a new procedure? How do you decide that you're going to buy this cautery machine versus that cautery machine, right? We look at the tool, we look at our problem, we look at the problem we're trying to solve, and then we look and see if it matches. When we look at the tool or the drug or the procedure, we use critical evaluation. We look and see, okay, are there any studies? Are the error rates published? Who did the studies? Were they done by drug companies? Were they done in a biased manner? And then we have journals that look at it. We have reviews that look at it. Quite frankly, we talk to our colleagues that we trust and we say, hey, you're more knowledgeable on this. Do you trust this medication? Do you trust this procedure? There's a way that we're all trained to look at drugs. It's no different than how we should be looking at AI or digital technology. We should be asking the same questions. We should be asking, okay, is there any data on this? Is this actually going to fix my problem? What does the contracts look like? What am I signing up for? Is it going to work with my practice, my patient population? So I would say for clinics and clinicians, we need to approach technology the exact same way we've been trained to approach medications or procedures or medical devices. And we have to ask those questions. But first, we have to understand what our problem is. Just because it works for the clinic next door doesn't mean that's not my problem. Like, I'm going to tell you, Jordan, like, documentation wasn't really my problem. I used my EMR really well. I had templates. I had set it all up. So when AI Scribe came along, it wasn't really the problem that I needed solving. It was nice. But I actually found that I worked better and I thought better because I had established a workflow that worked for me. So I would say start with your problem, start with your pain point, then figure out what it is you want to solve, then see if there's an AI or a technology that could solve that for you. But evaluate that AI in the same way you would evaluate anything else. And then try it. And if it doesn't work, break up with it. Don't stay with it and keep adding more band-aids to it. Just say, this isn't working for me. I'm done. And then try again. And I think a lot of, we just need to get into that quick failure type of piece of trial in the clinics.
Fail forward. Yeah. Don't be afraid to experiment.
Yeah.
Right on.
Are you a healthcare professional ready to take the next step in your career? Do you dream of a role where you truly make a difference in a community that's perfect for you and your family? Well then, let me introduce you to Cherry Health. Our platform puts thousands of healthcare opportunities right at your fingertips. Explore jobs by location, specialty, compensation, and more. All on an intuitive map-based platform, available on Android, iOS, or your computer's internet browser. Create your professional profile for free and get started messaging directly with employers. Beyond the app, Cherry Health also offers personalized, white glove recruiting services who can guide you every step of the way. Your dream healthcare career is just a click or a phone call away. Visit www.cherry.health to start the next phase of your journey.
Well, and then we've got DHC 2026 just around the corner here. What should we be expecting for the big event coming up?
I know. I think you're going to hear the excitement in my voice on this one, because I have to tell you, I'm obviously biased, but Ontario MD has this digital health conference. We have a virtual one in April and we have our in-person in October. And it's 2 days. It's October 1st and 2nd. And it's the only conference in Canada that is actually dedicated and targeted to digital health in the community. So it's really that clinician lens, that clinic lens, that team lens. And all the talks are very practical. It's very much about, okay, I'm going to come, I'm going to learn, I'm going to take home a pearl that I'm going to be able to implement tomorrow. The theme is creating capacity. Really, it's about creating capacity in your clinic. We have talks for specialists in the community. We have talks for obviously family docs and nurse practitioners, but we also have talks for staff. So we have office managers and executive directors who are giving talks on how to make staff life better, because that's really important also.
Wow, that's huge, right? They're an extension of yourself. And so like the more effective you get your team, the more effective you're going to be.
Correct. And we don't have time all the time to come in and learn about the new technology and user critical thinking. So we could actually send a student to the conference or our staff, because we have all the vendors, right? So if you come with that pain point and you come into the showcase and you come and listen and then you talk to the vendors, I call it one-stop shopping. I'm going to go there and I'm going to talk to like 15 AI scribes or scribe vendors or CDS vendors. And then I'm going to ask them all my questions.
Speed dates.
Exactly. Speed dating with vendors is the way I look at it. And then, yeah, exactly that.
How much has AI now taken over the conference? Is everything AI related, or at least somewhat?
No, because, I think AI is very important, and we don't want to underestimate how it's going to affect healthcare. And we do need to know about it. But there's a lot of functionality that's actually in our workflows. So AI is just a digital tool, just like our EMRs, and digital enables clinical, I always say. So there's a lot of talks about just efficiency in your workflows and where you can use technology efficiently. And it could just be using your EMR better, quite frankly. A lot of us don't actually know how, like, we don't know how to use our EMR better for our problems that AI may not be needed, right? So this is really about looking at your problems, looking at your workflow. AI is definitely there, but also other digital health. And privacy and security is always kind of number one, because around all of this, no matter what your digital workflow is, privacy, security, cybersecurity, those are all really important also.
Jordan, I'm really excited that the first day of the conference, Ontario's Information and Privacy Commissioner, Patricia Kosim, and Dr. Amal Verma, the co-founder and co-leader of Gemini, Canada's largest hospital clinical data research network, are going to join me for discussion on opportunities and guardrails regarding AI in clinical practice.
It'd be interesting to see, like, from the informed perspective, how they actually go about the implementation and seeing the risks of things. Because it's also, I don't know, it's tricky, right? It's jurisdictionally dependent. Like here in Alberta, if you want to try out a new AI tool, I think if you want to do it by the book, like you have to fill out your privacy impact assessment, and like you're going from the ground up, jumping through all the hoops. And so like just the barriers that are still in place to adoption, and like weighing out the benefits versus the risks. I'd be curious to actually see some of those talks and what their thoughts are.
Yeah, in fact, I think in Quebec, they've actually vetted the AIs that you could use. So every province is doing it a little bit differently. And so this is also a great place for other provinces to come and have those conversations and kind of learn from each other. So you're absolutely right. It is jurisdictionally, but I can say everyone's trying to figure it out right now.
I think most of us are hyped on AI, 2/3 of us by the sounds of things.
For sure. And we have some great keynotes and panels also. So I'm hoping that they'll add that extra flavor. We have Alika Lafontaine, Dr. Lafontaine, who just wrote the book Outrage Cure. And, his talk is really interesting. It's about trust in a time where healthcare is losing that trust because, quite frankly, we're kind of crumbling a little bit, especially the community and healthcare. And he's going to talk a lot about trust and building back that patient relationship, digital tools, but really the anger that everyone has with our healthcare system. And I think that's going to be really fascinating. We have Dr. Mike Evans. I think a lot of people know about him, and he's going to talk about kind of that knowledge translation, talking about digital use, AI use, especially with patients. We have an incredible panel, and we're going to talk about the AI-enabled patient and how that's going to impact healthcare, and the way as clinicians we're actually going to have to start changing what it is that we do to meet the needs of patients, because there's gaps in there that AI is filling, and we need to also work closely to build that trust again. And then we have Dr. Nandita Gupta, who's actually a cardiologist, who talks about creativity and humanity and that AI and medicine, healthcare and medicine. And it's really interesting how she takes art and she reflects it into what's happening in healthcare and technology. So we have a number of amazing keynotes and panels that are also coming in addition to the one that Ariane was talking about. My final thought is really about not underestimating how AI is going to change healthcare. I know we're talking about administrative tools and we're talking about AI scribe and we're very tactical, but I do think we need to step back and look at how this is going to affect our medical practices, how we're teaching our learners, how we're training our learners, how we're looking at what our role is in a team. I think a lot is going to change. And so right now we're focused on, should we use this tool in my clinic? But really, we also need to be looking at policy and governance and really leading AI so that it protects that trust relationship that we all have, not just physicians, but we all have with patients, and how to ensure that trust continues and it's not really dictated by vendors or organizations that are outside of that trust relationship.
It'll be interesting to see the conversation evolve and like how patients are adopting it from their side. You know, they're starting to use their own scribes for their medical appointments to help with health literacy, to help with remembering follow-up steps, right? And then from the clinic perspective, from the clinician perspective, it's an exciting time now.
And there's great publicly available information. If you come to Ontario MD's website, we have lots of information on AI tools, in particular AI Scribe. We have a patient consent toolkit. The CMPA has guidance with respect to AI also, the CPSO, the Privacy Commissioner in Ontario. So all these regulators, physician organizations can support you and support the public in understanding the tools and understanding best practices for implementation.
Hopefully we'll be able to stay out of the news headlines like those naughty lawyers.
I think it's bound to happen at some point. So let's just try and not make it, let's try and see if we can get in front of it.
Well, thanks so much for joining us today. I really appreciate it.
Thank you so much. This has been such a great conversation.
Thanks so much, Jordan.